It's Chris Beyer.
It's Chris Bowling. What's up, CB?
Hey, CB, it's August 2024. The year's
Ooh,
moving.
I don't like the sound of that. That means summer is almost over, and that makes me very sad.
Well, I'm sorry to make you sad today. You want a topic to make you happy?
Yes. What's our
I don't know if
topic?
it'll make you happy, but it is a good topic because August is National Eye Screening Month.
And
So we should be
considering
talking about that. Yes.
we both wear glasses, that's very
Yes, we
important
do.
to us.
This is very important to us, which is why I have to get back in myself because my prescription is going to be expired soon. But why did we choose to talk about this? I think there's a couple of things we've been noticing coming out of the pandemic, as we say so often, that we've noticed with our clients' claims that make eye exams unrelated to necessarily your vision policy a topic we wanted to discuss.
It is very important. And I don't know about you, but since COVID, so much screen time, my
Yeah.
eyes have gotten dramatically worse
Yes.
over the past 4 years compared to the previous 4 years of COVID. So I know
Yes.
that is important, but it is also amazing that an eye exam can detect onset diabetes or
Yes.
diabetes, which I found is fascinating. When I had my eye exam, and I think it was December, that was one of the check marks on the little report I
Yeah.
got. So
Yeah, it's definitely a screening that's probably not utilized as it should be. We were reviewing some client medical claim analysis, just looking at who within that employer group wasn't adherent to a certain condition management program, diabetic, high blood pressure, to see, okay, how many people do we need to help educate? And as we dove into that further, there were a few, but it wasn't so much that people weren't adherent to their type 2 or type 1 diabetic testing or screenings. They just hadn't had their eye exam, and that is considered protocol for diabetic care. So they were out of compliance. Something, you and I were just like, I guess that makes sense. It's hard to get back in and get that scheduled, but
yeah,
an important component.
and it's if vision is being offered through your employer, if there's an employer contribution, it is. I mean, you're going to make money on your vision plan every year.
Yeah.
It is, I think, once again, depending on where you're getting your eye exam, I think mine's like $110. So,
Yeah.
My goodness, I have a client, it costs the employee like $1 a month. I
Yeah.
mean, why wouldn't you buy that? Now, that's because we go get our eye exams every single year because, obviously we both wear glasses and it's
Yes.
important
It's
that,
needed.
yeah, because, all of a sudden you get a headache halfway through the day, you realize maybe my eyes are getting a little bit out of whack. So,
So my last two pair of glasses, I got blue light blocking coating on it.
smart.
It's helped with the eye strain, but I can still tell though I'm still fatigued by being in front of the screen as much as I am. Not as bad as the other glasses, but if I switch those out, I can definitely tell the difference throughout the day.
I have not thought about it. I've
Yeah.
had a lot of research around, or I've read a lot of research around that, and
Yeah.
especially people that are having a hard time sleeping at night. That they really need to no screen time 2 hours before bed,
Yeah.
but even
Just
then,
messes with you.
yeah, you should have your glasses on before.
Besides just getting in for the screening, I know that technology has also helped people maybe avoid the eye doctor itself. My wife got her prescription updated just by using an online app to get
What?
this prescription updated to do an exam. It wasn't the exam that would qualify for the diabetic care, but it was enough to measure what your prescription should be and send that back over.
No way.
So, and you start thinking of that, or now you're ordering glasses online without having to go into the clinic. I think that's another area that it's easy to not have to go in, but as we were talking for diabetic care, for diabetic prevention, it's definitely important.
I am so old school. I still go see the same ophthalmologist and
Yeah,
sit in the waiting room for flipping hour, and yeah, and then I spend $700 for glasses, and you're like,
they're nice glasses, CB. I will say.
I don't know if they're $700 worth compared to what you're doing, but I'll
Oh,
tell you, learn something new from you youngsters all the time.
oh, we're here to teach you. We're here to teach you. So, good topic, CB. Good to see you.
Thank you. Thanks for sharing.
Thanks.
We'll see you.
Bye bye.
Bye bye.